Greetings, this is Dr. Thomas Satterwhite, and thank you for watching this video. And the purpose of this video is to talk about facial masculinization and what to expect, before the operation, during the operation, and post-operatively. And it's, for all intents and purposes, a more appropriate term is facial gender affirming surgery, because the goal of any type of facial procedure, any type of procedure that's done in any part of the body, is to affirm your particular gender identity and your particular gender expression. Okay, and so there aren't any cookie cutter operations. That there's not this one size fits all mentality that I like to take. It's all about taking a very individualized approach with everyone that I work with. And so first and foremost is about meeting your goals, your wishes, your expectations. But with that being said, and for the purposes of this particular video, I'll be focusing on facial masculinization and kind of the general techniques that can be applied for facial masculinization. And certainly when we meet in person, we'll have a more in-depth discussion and have a one-on-one plan in terms of the types of procedures that we need to come up with, and working together to meet your goals and wishes. So with that being said, for anyone who does want to move forward with facial gender affirming surgery or facial masculinization surgery, it's really important, for you to understand what that process involves, not just what happens in the operating room, but before the operation, after the operation. And it's my job and my office's job to make sure that we do everything in our power to ensure that that process is as clear as possible, from the time of the consultation and then, to well after your post-operative recovery. What's also going to be important is that in my office, myself, we're always available. So if there are any questions, any concerns, you can always reach out, always available at any time during this journey. So with the consultation, with me, with my team, what are you going to expect? So first and foremost, and I tell this to everyone, safety is always my number one priority. And so when we're initially talking at the time of the consultation, I will spend, several minutes going through your medical history. So it's really important for you to fill out that intake form, to be as open, to be as honest as possible on all levels in terms of, your medical history, surgical history, medications, social history, smoking habits. These are all very important things for us to know to make sure that we're as safe as possible. And it's very rare for me to actually say no when moving forward with or when planning an operation. It's most important that I know every aspect of your history so that if there are any concerns, then we can work towards optimizing those medical problems or those medication issues in order to appropriately move forward. So once again, really important for you to be as open and honest with me and my team. So what I'm looking for in the medical history in your medical intake form is anything that can potentially lead to wound healing problems, anything that can lead to bleeding, anything that can lead to undue scarring, anything that can interact with anesthesia, okay? So in terms of your medical history, looking for a history in particular of diabetes, right? If you have a history of diabetes, that can lead to wound healing problems. So we want to make sure that's well controlled. History of HIV, because I want to make sure your CD4 count is normal, your HIV viral load is going to be undetectable. If you have a history of obesity or weight changes, in terms of a body mass index cutoff, I usually, because patients do ask, am I going to be too heavy for this operation? I do take it on a case-by-case basis. Roughly, it's a body mass index of 35 if you're above, and once again, a body mass index looks at a combination of your height and weight. But if you're, and that determines your level of obesity, and the body mass index will also be an indicator of having a higher chance of complications potentially, or overall systemic issues. But once again, it is taken on a case-by-case basis. But usually if your body mass index is above 35, they do ask you, to lose weight. But once again, there's always going to be variability. I've certainly taken care of patients who've had a body mass index higher than 35 and they've been fine. But once again, I think the key thing is, having a healthy, stable weight. And that's going to be important, not just for the operation, but just for, life in general. And also if you do have fluctuations in your weight, that can also affect the overall, results, afterwards. Other things that I'm going to look for, so prior surgeries, if you've had prior operations on your face, prior facial fractures, any hardware, I do get x-rays beforehand just to look at your face to help with the operative planning. Any medications that you're on, so any medications that can lead to bleeding or wound healing problems, so any immunosuppressive medications such as certain types of cortisones can do that. Any medications that can lead to bleeding, such as aspirin, Plavix, Coumadin. If you're in any anti-blood clotting medications, we want to review those. And then there's certain types of medications that interact with anesthesia, so I'll go through that with you as well. But basically list every single medication that you're taking, even if it's over-the-counter or herbal medications. That's going to be really important and fundamental. Allergies, any medication allergies that can lead to problems is going to be important, because I want to know if they're antibiotics that you use, because we want to be sure that we avoid those as well at the time of the operation. And then I'm also going to look at your own social history, like what kind of work are you doing, if you're working or you're in school, because that has implications in terms of your postoperative recovery. You do want to make sure that you take off time appropriately for recovery. You want to give yourself several weeks. What's your support? What's your social support? Are you in a relationship, family, friends that can support you? Because this can be a stressful event. So you want to have people around you that are going to support you as you go through this. And then also, if you have a history of smoking, tobacco products, vaping, marijuana, other drugs, once again, be open and honest. If you are using any nicotine products in particular, you do want to avoid those for about a month before and a month after, because nicotine and smoking of any kind can actually affect wound healing. If you're using edibles, THC or CBD edibles, usually that's okay around the time of the operation. That's not going to affect wound healing or the medications that you're going to be taking. But we certainly take it on a case-by-case basis, and we'll let you know. So once again, be very open and honest about those areas. And so then, at the time of the consultation, I will, talk with you about your goals and wishes. What is it that you're looking for in terms of, facial gender affirming surgery, facial masculinization, and, do a physical exam of the face, once again, to determine, what areas we want to focus on. The quality of the skin are going to be important features. And then certainly once you get your x-rays later down the line, I'll use that for reviewing. So with facial masculinization, interestingly, there aren't a lot of patients who do ask for it. I've been performing gender surgery of all types for years, and there's only a handful of patients who do ask for facial masculinization surgery as opposed to facial feminization surgery. And the reason why, it could be because of cultural norms, that because, oftentimes facial masculinity can be achieved with, facial hair for some patients, and that in and of itself, having facial hair is enough for resolution of dysphoria. Or perhaps in our own Western society, that having some degree of what are perceived as feminine features is not viewed negatively, but can still be viewed within the realm of masculinity and overall cultural acceptance. Regardless of the explanation, I think it doesn't really matter so much. I think what matters is how you feel as the patient individually, right? So what is it about your face that brings on your dysphoria, your discomfort, or even in some cases it can be a safety issue if you're being harassed because people aren't matching your face with your particular gender identity and gender expression, and that once again can be a safety issue. Once again, it's a very individual approach, so it's about you telling me what it is about your face that you would like modified, that you would like masculinized in order to meet your particular gender identity and gender expression. Okay, and there's a whole host of procedures that can be done, so not every person needs the same procedure. And once again, we take it on a case-by-case basis. So if I see you in person, once again, the physical exam, we take pictures. If you're from far away, or if it's a remote consult, then I'll use pictures, or I'll use video consultation to make a lot of those determinations. So what are procedures that can be done with facial masculinization? Well, overall, I think it's if we just stand back and look on a generalizable standpoint. So what makes a feminine face? What makes a masculine face? So a masculine face, and a lot of us don't think about this, right? Because I think we all look at a face and we'll label it masculine, and look at a face and label it feminine. But oftentimes we don't know why that's the case. But with that being said, A more more masculine face tends to have, a larger forehead, so more frontal bossing in this area, so more prominence. Eyebrows tend to be lower, higher hairline, sometimes even a receded hairline. Nose is going to be longer, larger. Cheeks tend to be a bit flatter. There can sometimes be a little bit of a hollowness in the lower aspect of the cheek, that chiseled cheek look that can sometimes be viewed as masculine. Chin tends to be a bit longer, so it can be longer in this respect, more projection, more width. And for a lot of patients, I think that the biggest area of achieving masculinity is going to be within the jaw, so having a larger, more square-shaped jaw. And then another aspect that can be looked at is the Adam's apple. So a more masculine face is going to have a more prominent Adam's apple. So the goal of a masculine face, or the focus of a masculine face, is actually in the framework of the face. So it's going to be along the jaw, it's going to be the forehead, as opposed to, and there's going to be just overall more square, as opposed to more feminine face, which tends to be more oval. And a lot of where there's more bulk in the upper part of the face, and the jaw and the chin tend to be smaller. And the focus of a feminine face is oftentimes around the eyes, as opposed to the forehead and the jaw. Okay, so that's one thing to keep in mind as we're thinking about facial masculinization. So once again, when patients do want to move forward with facial masculinization, when I've had those discussions, it oftentimes has focused really on the chin and the jaw area, and sometimes a little bit on the forehead in terms of creating that masculine appearance. But once again, we'll take it on a very case-by-case individualized approach. So assuming that facial masculinization is something I want to do, that you're considering all of the different options, what happens as we move forward. So once we come up with a plan, I'll let my team know that you're interested in facial masculinization after the consultation. They'll reach out to you shortly after the operation. They'll talk with you about working with insurance. So many of my patients do get appropriate insurance coverage, and so we definitely do everything that we can to make the process easier. So we'll call your insurance company. We'll really do all that legwork so that it's not going to be, a huge burden for you. And then we'll also talk with you about scheduling. So my team will go through my calendar with you to find a date in order to move forward. And I think what's important for you is coming up with a date where you do have time to recover. You want to make sure that you have several weeks of time to recover before moving forward with the operation, because you don't want to operate and then immediately go back to work or back to school. You really want to give yourself appropriate time to recover. Really important. Making sure that you have your social network around you at the time of the operation. And then once we have that date, my nurses will also be in contact with you to ensure there are no changes in your medical history, that your weight's remaining stable, that you haven't had any additional operations, or if you've had operations, that you'll let us know. But any changes in your medical, surgical, medication history, and your social history. For some patients, we might have to get labs or blood work beforehand, or get clearance from your primary care doctor, or we might have to get an EKG to look at your heart. But this is going to be variable patient by patient. We'll certainly let you know what we need to do in your case to ensure your safety. Once we have that date of the operation, I'll see you in person, usually a day to a couple days before the operation. Some patients do opt to have the preoperative visit by phone or by video if they happen to live far away, if they can't make it here. But once again, we'll have that discussion before the operation to reconfirm the surgical plan and what you want to do. We'll also get your consent or permission. We'll also provide your prescriptions as well, which you'll be able to pick up at the pharmacy. And we'll also confirm your lodging, where you're going to be staying, who's going to be staying with you, all of your contact information. So once again, ensuring your safety net. So on the day of the operation, you'll show up to the hospital or the surgical facility. There are multiple places at which I operate, but you'll show up, you'll meet the team, the staff. I've worked with the same team, for years, but you'll meet with them. They'll, once again, review your medications, your medical history. You'll see me shortly before the operation. I'll once again repeat the operative plan. I want to make sure that repetition is always a good thing. And then you'll be brought to the operating room and you'll be asleep. And facial masculinization can be anywhere from an hour to 8 to 10 hours, depending on what we're going to be doing. Okay. So for facial masculinization, as I said, a lot of the goal is going to be in the lower part of the face. So having, a wider, more prominent chin, wider, more prominent mandible. So this typically involves an incision inside the mouth, where I expose the chin and the mandible. And there are lots of different options, and we'll talk about this. We can use implants or certain types of, implants, silicone or plastic, and other types of materials that we can use to help create a wider chin, and also implants that can be placed along the bone and then typically sutured or screwed into place into the bone to create a wider mandible. Other options may be what's referred to as a genioplasty, where I actually cut the bone and resize it. I can bring it forward, I can widen it, and that can also be an option in terms of creating a fuller chin. And there are advantages and disadvantages to both of those. If we do the genioplasty, where we cut the bone and then bring it forward and make things wider, I think the advantage of that is that we're using your own body's material rather than bringing in, silicone or artificial material. However, the recovery can be a little bit longer. You might have a little bit more swelling. There's also a higher chance for having, damage to some of the underlying nerves that you have within the mouth. So that's something to always consider. I think both options are quite good. We can certainly go into more detail about that at the time of the consultation. I think with the implants, they tend to be faster operations. The genioplasty might take, potentially, an hour or so, maybe sometimes even longer. The implants, really simple to put them in and then, hold them into place with sutures or screws. That's something to definitely keep in mind. After the operation, I use absorbable sutures to close the incisions inside your mouth. And so there's not going to be anything that's going to be visible. It's all going to be on the inside. And so then what are other aspects? So that's usually the primary procedure that patients do like to have for facial masculinization. But some patients want the cheeks addressed. They might feel that their cheeks are too full or too round and they want them more chiseled. So what we can do is actually remove fat from the cheeks, either through liposuction by using small little cannulas, typically right under your ear, that go into the cheek to take out some of the fat. There's underlying fat that's referred to as buccal, B-U-C-C-A-L, buccal fat that lives there that we can also take out, oftentimes from an intraoral or inside the mouth incision. So those are ways of actually addressing some of the fullness in the cheeks, if that's something that does bother you. Other areas that can be addressed can be the brow, right? If you feel that you want more contouring of the brow, this typically involves an incision that's made on top of the head, pulling down the skin, and then doing whatever contouring needs to be done. We can burr or sand the forehead to shape it in a way that you want it to be, or we can add material to it, either bone grafts or artificial material to create more of a prominent frontal bossing, if that's something that you feel is going to add more to a masculine appearance to your face. We can also do fat grafting to add fat to the area, where we take fat from another part of the body and inject it into that area to create more contour. So fat grafting in general can also be done in other parts of the face, such as the cheeks, if you do want to have fuller cheeks, which can be either deemed a masculine or a feminine, trait, depending on how the fat is distributed. Or even putting fat in the chin or cheek area, and that can be a nice way of creating fullness and width and more, I suppose, protrusion in those areas, which can be deemed, once again, a masculine trait. So once again, fat in the jaw and the chin can be another method, in addition to using certain types of implants, or in terms of doing what I said before as a genioplasty, which is cutting the bone and shaping the bone. So once again, lots of different things that can be done. The other area that might be addressed, your patients have brought up, is with the Adam's apple, a way of making that more prominent. And there are procedures that can be done to create a more prominent Adam's apple, if that is so desired. So taking cartilage or using other types of material from other parts of your body, and then actually placing it over that area to create more protrusion, is something that can be done. Once again, not very common, but certainly something that can be done in facial masculinization. So once again, facial masculinization involves a whole host of procedures, and we're going to focus on those procedures that is important for you in terms of making you feel and look as masculine as possible. So after the procedure, depending on what we do, in most cases you'll have a pretty snug compressive dressing over the face. If we've done anything with the forehead, you may have some drains that we typically take out the next morning. You stay with us overnight, either in the surgery center or in the hospital, and then usually by the next day you should feel ready to go, but we certainly take it on a case-by-case and a day-by-day basis to see how you're doing. But once again, vast majority of patients feel ready the next day to go to leave. If you're in from the San Francisco Bay Area, you'll stay here in the Bay Area, recover. If you're from far away, we do ask that you set up lodging, so either hotel, Airbnb, family and friends that you can stay with here in the Bay Area, for, at least a week or so after the operation, so we can keep a close eye on you. Your job is to take it easy, stay stress-free. You'll stay on a soft diet, so nothing firmer than the consistency of maybe mashed potatoes or scrambled eggs for about a month post-operatively. If we've done any work on the jaw, you'll have an antibiotic rinse that you'll use 3 times a day for the first week to 2 weeks or so after the operation. Typically be on antibiotics as well. You'll have pretty strong pain medication, but most patients really only use that for, I would say, maybe about 3 to 5 days, maybe even up to a week, but everyone's going to be variable. During this time, you should be okay to take a shower. You'll do wound care and incision care if you do have any incisions on the top of your head. If you've done any forehead contouring, antibiotic ointment a couple times a day. You'll come back and see us a week later. We'll inspect everything. If you have any sutures or stitches or staples that we need to take out, we'll do that. In your mouth, we'll take a look, but those are going to be absorbable stitches. If we've done a rhinoplasty, so some patients do want to move forward with nose procedures. Once again, rhinoplasties are not necessarily, within the realm of gender-affirming, surgery, but if, you do want to have a rhinoplasty or a nose operation in the setting of other procedures with the face, that certainly can be done. But regardless, if we do a nose type of operation, you may have a splint or a cast that we do take off a week later when you come back to our office. And once again, with a rhinoplasty and a nose procedure, we do come up. Everyone's has different noses and different goals and wishes, but we'll come up with a plan that'll meet your particular goals and wishes for how you want your nose to look. And after that first visit, if you're doing well, which I assume you will be, and you live from far away, then you can leave and then go back home, safe to travel, safe to fly, safe to be in a car. And then we'll typically have a follow-up a couple of weeks later, typically by phone or by video. If you're in the Bay Area, then we'll set up another follow-up visit several weeks later down the line. If there are any issues or concerns, you can always reach out. We're always going to be available, always around for you, so you can always reach out. So, post-operatively is going to take some time. You'll certainly notice those differences of your face after facial masculinization surgery. But you're still going to be swollen. Most patients don't feel ready to be out in public until anywhere between 2 to 4 weeks. So if you are working in school, then you usually want to give yourself at least a minimum of 2 weeks. If you have a more labor-intensive job, maybe about 4 weeks. But I would say roughly anywhere between 2 to 4 weeks, depending on how you're healing. Some patients take a little bit more time in terms of the amount of swelling that they have. Avoid strenuous activity for 1 month, because strenuous activity can lead to swelling, bruising, can lead to bleeding. So really avoid any strenuous activity for about 1 month. And then after a month, you can start exercising again. Scar care is important. So if you do have an incision, under the nose or along the top of your head, you do want to start using silicone cream, usually about 2-3 weeks after the operation. And we'll instruct you on that in terms of when's the right time to use scar cream. Avoid direct sunlight, because sunlight can also cause the area to darken and scar. So you really want to be cognizant of that for about the first year after the operation is going to be really important. I would say that as you get to about the 1 month to 6 week mark, things look pretty good. You're still going to be swollen, particularly in the jaw and the chin. About the 3 month mark, things are going to look quite good. I would say that about 80% of the swelling is gone, and then you have this lingering 20% of swelling that typically stays until about 1 year post-op. Swelling loves to stay in the chin, in the jaw, and the nose. You really want to be patient. So if these are areas that we've operated on, it can take until about a year until these areas resolve. What are other things to keep in mind? So, if we've operated on the chin and the jaw, you can have some numbness, and this can persist up until about a year. So the lower lip, the chin can be numb up until about a year post-op. And upwards of about 2% of patients, sometimes even more than that, the literature has reported anywhere from like 10 to 15% of patients don't get full sensation to the lip and the chin. Most patients do regain, all of their sensation. There's some patients who regain partial sensation, but having complete loss of sensation is rather rare. But you do have to keep in mind that there can always be the potential of having diminished or lost sensation in this area. For most patients, expect that the sensation will be gone immediately post-op, but after about a year or so, it will come back. So you want to be careful with eating. avoiding really hot foods because you might end up burning your lip, and a big reason why you want to stay on soft food for the first month so you don't end up biting your lip, which can lead to bleeding and lead to other injuries as well. If we've done any work on your head area, you can have some numbness as well because some of those nerves have been traumatized or severed or cut, and it does take up until about a year. One thing that can happen, year for recovery. Another thing that can happen is hair loss. Sometimes a couple months after the operation, hair can start to fall out, which can be very distressing. This is, normal. This can happen in probably about 15 to 20% of patients, but it will grow back, and it can take up until about a year for all of the hair to grow back. So you do want to be aware of that. So other things that can happen, so infections are pretty rare. You're kept on antibiotics post-operatively. Bleeding or needing a transfusion or having what's called a hematoma, where you have massive bleeding under the skin, really rare. Less than 1% of that happening. If it does happen, it typically happens within the first 1 or 2 days. Let's see, there can be, we talked about, swelling can persist for a long time. Need for revisions tends to be pretty low. I would say probably about 2 or 3% chance of needing to come back and having touch-up or revision procedures. Usually it's because you might have a scar that you're not happy with. So maybe if we've done an incision on the scalp and the scar is thicker than you want it to be, or maybe the implant has become malpositioned, that needs to be redone. But the chance of that happening, once again, is fairly low. If we've done fat grafting, to any parts of the face, sometimes that fat reabsorbs. You expect about 50% of that fat to reabsorb. So that can also be a reason why we'd have to move forward, with some type of revision. Post-operatively, one thing to keep in mind is that, you may have a compressive wrap, and that typically does need to stay on for about about a month or so after the operation. The longer you wear it, the more it decreases the compression, and the faster the healing. So I think the general gist of, facial masculinization is that, I want to do everything that I can to meet your goals and wishes, right? So I think having that careful discussion and laying out a plan is going to be important. I think there are a whole host of procedures, but we want to find one that's specific for you. Safety is my number one priority, so it's really important for you to be as open and honest with me as you can, in terms of your medical history, surgical history, medications, family history, social history, so that we can optimize your care. And that it's going to take some time. And even in that post-operative course, there's always going to be some degree of unpredictability. So if things aren't the way that you want it to be, we can always come back and revise and talk about that, but you definitely want to give it time. The operation, I tell all my patients, in and of itself is always the easy part. It's that post-operative recovery that can really take that time. That really takes time and dedication. So you really want to make sure that you have the appropriate, expectations, and understand that you want to give yourself that time to heal as you go through the process. Thank you.